Good afternoon, ladies and gentlemen. We bring you greetings from RICHMO Media to your doorsteps. Today is another brightest day that the good Lord has given to us, and we welcome each and everyone to RICHMO Media Health Issues. This afternoon, we have another special topic for our discussion. And the topic for today is entitled Preventive Measures of Epilepsy. Preventive measures of epilepsy. So, at the end of the lesson, our guests will help us to be able to really understand what really it is when it comes to epilepsy and how we can handle it. So, our guest for this afternoon is our own brother Samuel Insana, and he will be helping us with this topic. So, brother Samuel, you are welcome to Richmond Media Health Issues.
Thank you very much for having me this afternoon.
Thank you. So,
I
our
hope you
viewers
can
and our
hear me.
listeners, we thank God that He has given us brother Samuel today for us to dive deeper into this topic, epilepsy and its management. So, brother Samuel, please, what should be our viewers and our listeners' expectations in regards to today's lesson? Thank you.
So, good afternoon to our cherished viewers and listeners. Um, it is I'm very happy for you to have me this afternoon. All viewers and listeners should expect nothing but the best. They are going to be informed about what epilepsy is, and they can make better decisions going forward.
Okay, thank you. Thank you very much. Okay, brother Samuel, please, as we are about to start, can you please explain what epilepsy is to our cherished viewers and listeners?
Okay, so epilepsy is a disease. It's a disease, but this type of disease is normally chronic. And when we say a disease is chronic, it means to a large extent the disease comes to stay for some time. And with epilepsy, this disease affects the body parts, and the body part we are talking about here is the brain. So normally epilepsy is a neurological disorder or a disorder that attacks or affects the brain, and it manifests itself in diverse ways, like seizures. We will see people fainting, we will see people falling into unconsciousness and other things. So epilepsy in simple, it is a brain disorder, or it is a neurological disorder, a disease that affects the human brain and normally manifests itself in diverse ways. So that is what epilepsy is.
Okay, thank you very much. So, for us to know, it means we are going to talk about a condition that emanates from the brain. I hope that is
Exactly.
the lesson for today. Okay.
Exactly. Exactly.
Yeah, please, can you please take us to some of the facts in this era on epilepsy?
Okay. So, as I said, epilepsy is a brain of the disease. One thing I want us to know or take or pay good attention to is epilepsy is not a communicable disease as we used to think. Epilepsy, when one is suffering from epilepsy, you can't transfer it from that person to another. Simply put, I can't give epilepsy to another person. It is a brain disease that normally um, manifests itself in a strange way, in that the person may be fainting, the person may be having seizures, The person may be suffering from a lot of things. The person may be unconscious. The person may fall and sustain some injury. And when people go through this, normally it is difficult for onlookers or people who are passing by to help such people with the perception that epilepsy is communicable. And epilepsy is never communicable. You can't transfer epilepsy from one person to another. That is one thing I want us to look about. And epilepsy respects no person. It's a respecter of no person. So in the whole world, we have about 50 million people living with epilepsy or suffering from seizure disorder worldwide. As I said, it is a neurological disease. That means it's a disease that affects the brain and how it functions. Okay. So the good news about epilepsy is about 70% of people who suffer epilepsy or seizure disorders are likely to recover or are likely to be seizure free when they are early diagnosed and they are treated very well, about 70%. So if you take any 10 people who have once suffered from epilepsy, if they are identified early and they are putting on treatment, about 7 of them will recover fully and become seizure free. They will live a seizure free life afterwards. That is one fact also. Then another fact is people who have low socioeconomic standard. So epilepsy is prevalent in people whose their financial status or their let me put in quotes, people who are poor. So if you look at epilepsy, it's more prevalent in sub-Saharan Africa. So it's more prevalent in people who have their standard of living is below average. Um, so those are the basic facts I want us to look at this afternoon. Most people who are living with epilepsy or people who are associated with seizure disorders are normally stigmatized against because of how the condition manifests itself. The signs and symptoms associated with epilepsy makes the condition to be what? Stigmatized. So there's a need for us to destigmatize epilepsy because epilepsy is not a demonic disease. Epilepsy is not cursed. People who suffer from epilepsy or people who are living with epilepsy are not accursed. It's a disease, and it is a neurological disease, a disease that affects how the brain works and the structure of the brain and how the brain functions. So epilepsy is not caused by, we have a lot of myth in Africa that epilepsy is caused when you eat, when you are pregnant and you eat in public, your child is likely to suffer from epilepsy. um when you help or you offer help to somebody who is suffering, who had epileptic attack, you are likely to suffer from epilepsy. Those things are all myth. They are misconception which needs to be cleared. Epilepsy is not a communicable disease and you can't transfer it from one person to another. So those are the key facts we have to look at. Fact, a lot of people are really suffering from epilepsy.
Okay. Thank you, Brother Sammy. So it means if, for example, a parent, let's say the mother is suffering from epilepsy, it means it's not guaranteed that when she give birth, the child will also suffer from epilepsy. I hope
Exactly,
that is what you want
exactly,
our viewers to understand. Yeah.
exactly,
And you have
exactly.
brought a point that we don't buy for someone, but rather
As,
it's a brain related problem.
okay. So
Okay,
as
thank
we
you.
go forward,
Please,
we will see how the condition comes about. It's not about you being accursed or you buying epilepsy. Or they say you've bought epilepsy. No, that is not the fact. Epilepsy, we will look at how epilepsy can come by as we go on. So you can't buy epilepsy, or it's not a demonic attack or by the sins or the sins your forefathers has committed, so you are paying for that sin. No, that's not about epilepsy. They are all misconception. They are all false theories people has conspired about the condition, because it we people don't really understand the condition, how it comes about. So we try to attribute a lot of things to the condition. Yes.
Okay. Thank you. You were mentioning about seizures, epilepsy, and the rest. Please, are
Okay.
there types of epilepsy? And if they are, can you please take us through if we have types of the epilepsy and the seizures as well?
Okay, so I want us to bring a clear distinction between what epilepsy is and what seizure is before we even move on. So when we say somebody has suffered from seizure, it means the person had a brain problem, a problem with the brain, and the person has witnessed the signs and symptoms of that brain problem. So what I'm trying to say is, when you see somebody falling, fitting, somebody lost of consciousness, somebody having some signs and symptoms of seizures, which I've just mentioned, you can't say that person is experiencing epilepsy. So a lot of we have different causes of seizures. When you suffer from seizure, and it is the first time, the first episode, we don't conclude that you have epilepsy. We can only say one is suffering from epilepsy if the person has suffered more than one seizures. And that one, more than one seizure, that means two or more. And that one too, it shouldn't be within 24 hours. That means it shouldn't be within one day. So if somebody, the first time somebody has fallen and the person has muscle contraction and muscle relaxation or muscle rigidity, and we can't conclude that a person has epilepsy, that wouldn't be epilepsy. We will call that one seizure. But if that is separated within 24 hours and we can't point to one particular thing that this is causing the seizure, then that person can be diagnosed epilepsy. Basically, we have two major types of seizures. We have the focal seizure and we have the generalized seizure. When these are technical terms. When we say a seizure is focal, it means the part of the brain. When you look at the human brain, how God has created it, we have the right hemisphere and we have the left hemisphere, which each hemisphere has its own function it performs. So when you are suffering from seizure, it is a focal type of seizure. It is likely that only one part of the brain has been affected. Whatever being the cause, we will discuss later. But if only one part or one segment of the brain is affected, that means the part of the brain, the body part that part of the brain controls, is also going to be affected. So we'll see the seizure manifesting itself in those parts of the body. The second type of seizure I want to talk about is the generalized seizure. And this type of seizure happens to affect the entire brain structure. That's why we call it generalized seizure. So that is what is most of the time we normally see. And you see that the entire body is affected. So the person may faint, the person may have body rigidity, the person may lose consciousness and go through all the various stages of seizures. So that is what is known as. So we have two major basic types of seizures. The focal type, which the disease affects only part of the brain, and the general type, which affects the entire brain. So sorry, I can't really hear
I'm
you.
saying you can please continue with the types of the generalized seizures for us.
Okay, so we have different types of generalized seizures. We have absent seizure. So some people may not fit, as we all know. epilepsy to be. So it is not only people who fall down that we say they are suffering from epilepsy. We have a type of seizure, we call it absence seizure. These people will normally stare into space and have loss of consciousness for a very short time, sometimes 15 seconds, and the person regains consciousness. And this type of seizure is common with children. So you may have a child who is not performing very well at school. The teacher will teach and the child will not understand. It could be likely this child or your ward may be suffering from absence seizure. The child will never fit, the child will never have muscle rigidity, but the child may be suffering from absence seizure. And this is evidence or the clinical manifestation or the presentation for you to know somebody is suffering from absence seizure is the person appears to be staring into empty space. And that is what we call absence seizure. We also have the tonic seizure, where normally there is muscle rigidity. So you see the muscles of the person getting stiffened and hardened. So that is the tonic seizure. We also have the clonic seizure, and this is when mostly we refer to as epilepsy. This type of seizure, there is jerky movement, there's contraction and relaxation of the muscles, so the entire body is turned into jerky movement. That's what we call the clonic or the tonic clonic seizure. So we have other types of seizures which we'll be discussing. So basically, the general type of seizure has a lot under it. It does not necessarily mean the person should fit. It is not always guaranteed that the person should fit. Somebody can be suffering from epilepsy or seizure and the person will not fit. The person's body will not move. There will not be stiffness. There will not be jerky movements, but such an individual will still be battling with seizure.
Okay, thank you. So it means, as you said, not always those who are falling means they
Yes.
have epilepsy, but someone
Yes.
can have epilepsy, but that person might not be falling.
Exactly. The
Okay,
muscles will not be
thank you.
rigid. The muscles will not jerk, but the person will be suffering from absence seizure.
Okay, so our viewers and our listeners, you can see how Brother Sami is gradually taking us through for us to get a clearer view that we need to pay much attention to the brain because that is where this condition comes from and how we can be able to handle those with such condition so that we can also help with their care. Beloved, you can subscribe Richmo Media so that anytime that there is a program on this platform, you will be the first person to get in touch if you have not subscribed. Then if you have subscribed as well, it's a matter of you sharing today too for others to also get involved to this nice presentation Brasame is taking us through. So we want to continue. Though people are having these conditions, what are some of the clinical manifestations of epilepsy?
Okay, so when we say sign the clinical manifestations or what will show that this person is having epilepsy, as I said, you can't the fact that the person is fitting does not guarantee that the person is having seizures. Yes, of course, you have to go to the hospital for a medical practitioner to diagnose this person of the condition. So normally somebody who has been diagnosed or somebody who is battling with epilepsy,
Okay, okay. Viewers and listeners, I think the network has done its work, but we are hoping that Brasame will join us soon. We are just going through the signs and symptoms. So let's be patient for us to know that these are the things that when an individual is manifesting or when it's occurring in an individual that we call epilepsy might be present. And that is what he is about to take us through. But even if nothing at all, we have known that not all epileptic people fall, but rather we have some who might be staring at you. The person might be staring at you by raising the head in a space, but might be having seizures, and that is a mild form. So, Brother Sami has joined us. So, Brother Sami, please, you can continue for us. Thank you.
Okay. So normally I have mentioned the things, the presentation of somebody who has been battling with seizure or epilepsy. But normally, when one is having epileptic attack or seizure attack, especially the tonic-clonic state, that's the general type, you see the person will have temporal loss of consciousness. Before that, some people who have been living with the condition for a very long time have warning signs. They have warning signs. Sometimes they feel like butterflies in the stomach. They feel uncomfortable feelings in the stomach. Some may be having dizziness, headache, lightheadedness. Those are the signs that you are about to have an attack. So the person will experience this, and those who have been living with the condition for long can do something to help themselves. But those who have not, there are some type of seizures or people respond to it differently. Others may not have any sign, any warning sign at all. They just have the attack immediately. So, as I said, the person will go into loss of consciousness. That means the person will not be aware of what is happening to him or her at that moment. The person may fall down if not supported. That is where they sustain a lot of injury. Even if they are with fire, because there's loss of consciousness, they fall into fire and they will not know they are falling into fire. They can get drowned if they are closer to river bodies or whatever. They can get hurt, sustain fracture, and burns, injuries, wounds because of the loss of consciousness. Then, after that, the body goes into stiffness. The body becomes very stiff, very rigid, that you can't control the body. Following this is when the person will have jerky movements, or they will be twitching, what we call twitching, or what we really refer to as seizures. The person will fall into twitching. The muscles will relax and contract simultaneously. And these are all coming from the brain, the signal the brain is giving to the body, the command the body is giving to, the brain is giving to the body to carry out. Normally, let me be a bit tactical with this. The brain, God has made it in such a way that the brain sends signals. So before you can drink water, before you can walk, you can sleep, before you do everything, the brain sends signal to the body that this is what the body is requesting. So you ought to carry it out. And these signals are carried by neurotransmitters. They are chemicals in the brain that perform function. So when the body, the brain is not give some instructions without the body being aware, what the body have to do is to obey those instructions. And that is what we experience, we see in seizures or epilepsy. The chemicals that are supposed to give this instruction, when they overdo, or when they are instruction they are supposed to give, they overstep their boundaries. That's when we have seizures. Okay, so you see the body fitting and the body thrown into a lot of activities. All right.
Okay. So we
Yes.
thank you. So for you to be able to enlighten us on some of the things that might happen. So it means It doesn't mean the person was there and some spirit passed that individual and he fell. But there is
No,
a
no,
coordination. There
not
is a
at all.
message the brain is
It's giving.
giving, and that
Exactly.
is what the individual might be going through. And that is
Exactly.
why when they even go through that process, you realize that when the brain is relaxing, then they will recover.
They recover. Exactly. Exactly.
Okay,
So after those series of events, when the brain give the command, yes, the body has to obey. So that's when you
sure.
see the series of events. Some will fall into deep sleep after this
Mhm.
series of events,
Sure.
eventually recover and resume normal life. Others, just after the fit, they don't fall into deep sleep. They don't go into the coma phase. We call that stage coma phase. They can
Okay.
recover and continue with normal life. Yes.
Okay. Then this one too is serious. So, Brother Sammy, as you are saying this one, as people are saying it's spiritual, they went to buy. What are the causes of this condition?
Okay. So currently, there's a lot of research into this field, and they are not conclusive causes. We can't pinpoint that this is the cause, this is the cause. However, research evidence suggests that
Okay. To our viewers and our listeners, we know Brother Sami will join us soon. But where we have reached now is very important because if we are able to know how this condition occurred or what can come together to lead to this condition, then it means our viewers, our listeners, we can be able to prevent ourselves from doing those things, from going closer to those things that might cause a problem with the brain leading to epilepsy. And that is what Brother Sami is about to take us through gradually for us to know the exact causes of epilepsy. Thank you. So, Brother Sami, welcome back.
thank
Take
you
us
very
through
much.
the causes again.
So I want to talk about brain damage. Brain
Okay.
damage, as I was saying, the and brain damage can happen as a result of insufficient oxygen to the brain. And normally it is common with children, maybe during childbirth, choking, asphyxia. When the brain don't get the adequate amount of oxygen, one, the brain begin to degenerate, the brain cells begin to die off gradually, or the brain cell begin to get damaged, and that could be a cause of seizure. We can also talk about congenital abnormalities. There are some children who are born with a lot of abnormalities like Down syndrome, phenylketonuria, a lot of conditions. Those children are likely to suffer from seizure disorder or get epilepsy, suffer from epilepsy because of the malformation of their brain cells. So those individuals are predisposed to epilepsy. One thing I also want to talk about is head injury. Head injury. Any injury to the head, any trauma to the head can predispose an individual to epilepsy. So you see, sometimes we put our children on very high beds, young children, I mean children, infants. We put them on bed, we don't choke them with pillow. The child rolls over and fall down, the head hits the ground. You are gradually predisposing your child to conditions such as this. So brain injury, sometimes road traffic accidents can, somebody may not be having seizure disorder, epilepsy from childhood. He suffers a road traffic accident, the head hits the ground or knock against something, and that could be the onset of epilepsy. There are some certain conditions like stroke, cardiovascular accidents, when you suffer, because stroke happens to deal with the brain defects. And when an individual suffers from stroke, the likelihood of the individual also suffering from epilepsy is very high. Then we can also talk of infection. Infection, just like meningitis, infection, just like malaria. We have a type of malaria, we call it cerebral malaria.
Okay, Brother Sami will join us again. So we can see that he is gradually taking us through, and the things that he is mentioning gradually is things emanating from the brain. So he has reached where you have malaria, but in this case, the parasite has affected the cerebral part of your brain, and that can lead to abnormal electrical charges causing epilepsy. That is where he has reached. Brother Samuel, you can continue.
Okay, so certain toxins. And when we talk of toxins, people think it's only poison. Normal alcohol intoxication, and alcohol withdrawal can also contribute to epilepsy. So those who abuse large volumes, high concentrated alcohol are also prone. So when you go to the hospital, most of the seizure disorders that we record at the hospital are people who abuse one way or the other alcohol. And those people, so those also, you may be abusing alcohol and may not suffer from seizure disorders, but the withdrawal symptoms are associated with alcohol abuse or alcohol dependence can also predispose you to seizure disorders. So these are some of the causes to mention, but a few of epilepsy. And out of the list I have mentioned, I've never mentioned that epilepsy is communicable. I've
Yeah. Yes. So it means it's just a lifestyle related, and things, external factors or internal factors that affect the proper functioning of the brain. But as he was mentioning, you can realize that there are some triggers of seizures. So it means someone who is drinking alcohol, he might not be experiencing the seizures whilst drinking, but when he is stopping, and that is what we call the withdrawal, the process that he will be going through, that can also affect the electrical charges and can trigger seizures as well. And so we are the where we are talking about the triggers of seizures. So thank you. Brian Same is back.
So when an individual is being diagnosed of suffering from seizure disorder or epilepsy, it doesn't mean all the time the person will be having the attack. The person lives a normal life, goes about his normal duties. The issue is when you are diagnosed or when you are living with seizure disorder or epilepsy, something have to happen before you have the attack. And that is what we term the trigger factors, or what precipitates the onset of the condition or the onset of the attack. And to mention that, the first one is stress. Stress. When you are being diagnosed of suffering from seizure disorder and you stress yourself, it can easily trigger the onset of the attack. Then dehydration, normal dehydration. If you don't take a lot of water, you can easily have the attack because the brain needs nutrients. Yes, of course, water for its normal functioning.
Yeah, so
Then
Brian
those,
Same is
as we spoke about,
yeah. Okay, Brother Samuel will join us again. So you realize that he's talking about water and the linkage of triggering attack, because The brain, the majority percentage of the brain is water. And if you are not taking in water, it means the proper functioning of the brain will be impaired. Then it can lead or trigger the attack. Brasame, please, you can continue from there.
Okay. So hormonal changes, and this is peculiar to our females. Your menstrual cycle, during your menstrual cycle, you lose some hormones, or some levels of hormones go down for you to have your menses adequately. That can also predispose you to the onset or the attack of seizure. Then I also want to talk about hunger. Hunger. When you fast for long or you deprive yourself from food, it can also trigger epilepsy. Then anger, extreme emotions. When you're extremely happy or extremely angry, it can also predispose you to what? Epilepsy. So extreme emotion is one of the triggering factor for seizure disorder. When you don't have enough sleep, when you don't have enough sleep overnight, it can also trigger epilepsy. Then what I want to talk about is stimuli, excessive stimuli, especially visual stimuli, sometimes noise, auditory stimuli can also, excessive auditory stimuli or excessive visual stimuli can also trigger epilepsy. Then hello, hello.
Yeah, Brasame. So with
Hello.
this, what are some of the
Yes, I
treatment
cannot hear
options
you.
of, yeah, treatment options of epilepsy? Thank you. Okay. So Brasame is still working on his net. Brasame, please, if you can hear
Yes.
us.
Yes, now
Yeah,
I can hear you now.
we want to look at some of the treatment options of this condition.
So the good news is epilepsy is a treatable condition.
Okay.
That is the good news. As I said from the beginning, about 70% of people who suffers from this condition can be seizure free. When we say seizure free, that means they will live a life that they will never have the attack again. That is what I meant by seizure free. So epilepsy can be treated in any government hospital in Ghana, any health facility. Almost every clinical health practitioner have been trained on how to manage epilepsy. So we have basic medications which are not too expensive that we can use to treat epilepsy. So epilepsy is easily treatable. We have medication therapy. Um, at advanced level, they may subject you to surgical therapy, but when epilepsy, your first episode, second episode, we've diagnosed you of epilepsy. So early detection and treatment is very vital and is very important in the treatment of epilepsy. When an individual is identified at the early stage and diagnosed with the right type of epilepsy and the right type of treatment, basic medication, the person is likely to live a seizure-free life after a continuous treatment for about 2 years. So within that period, within that 2 years duration, if the person has never suffered any attack within that 2 years duration, and the person goes for review, and the person is managed well, and the person has not suffered any attack, we gradually wean the person off the medications, and the person can be seizure free even without the medication. So epilepsy or seizure disorder, if the cause is identified and managed well, the person can be seizure free. So epilepsy is treatable. It can be managed. Yes. As I was talking about surgical intervention, so the part of the brain that is defect, um, sometimes there are advanced procedures to perform a surgical intervention, an operation on the part of the brain. Sometimes they take the part of the brain that is affected, the entire lobe out. That is an advanced procedure. I don't want to go into details. But what I want to say is epilepsy is treated, and we treat it with medication at every facility. Every health center you go, every clinical health professional is trained in managing epilepsy, and it is treatable with medication. Yes. So, yes, of course, we preach that prevention is always better than cure. So it is
Sure.
better you don't, the onset of the condition is not even experienced. So we prevent people from getting the condition so that we don't even think of treating or managing it. So the first thing I want to talk about is avoid the consumption of alcohol and cigarettes.
Okay, so viewers and listeners, we have reached the most vital part, the preventive measures of by God. You, a viewer, is suffering from this condition, epilepsy is treatable. And by going through whatever our guest is through, you realize that the causes, you will refrain from them and you will be true. So we are going through the preventive measures, and that is what Brother Sami has started for us. Please, you can
So
continue.
I was talking about our mothers, our pregnant mothers, the need for them to visit the hospital for antenatal services. It is very important. Not only the antenatal services, but during delivery. It is important for you to have your delivery at the hospital as possible as it is. You need to get a trained health professional to assist you in your delivery process. Normally, we stay in the house, we deliver through a lot of means, and our children go through a lot of suffering. Children who are delivered at home, not by a trained health professional, you are predisposing your child to these conditions we are discussing. So it is important you deliver at the hospital. Then let's avoid as much as possible head injury. You see people riding motorbike, riding bicycle without head helmet, without protecting their head. And the head is the most delicate part of the body. We need to protect our head from injuries as much as possible. I talk about drugs, the intake of drug. We buy medications on the market not knowing what the source is. This can be a source of poisoning to our. So basically, the prevention is basic health preventive measures we are talking about to promote our health. And this go a long way also to promote, to prevent us against these conditions we are talking about. So it is very important. So these are the preventive measures. And yes, of course, when you get an infection, you treat it on time. When sorry for that. When you are suffering from any type of disease, any type of infection, don't sit at home and be buying over the counter medication. Visit the hospital, get a trained personnel to properly diagnose what the infection is and treat it accordingly. Don't sit at home and self-medicate, because those infections can contribute to the onset of seizure disorders. So and the most important thing is, when somebody suffers the first episode, which I called seizure, there is a need for you to visit the hospital, let them do all the necessary laboratory investigation and identify the basic cause of this seizure, so that it doesn't eventually end up in epilepsy, which is very complicated to treat. So those are the preventive measures I want to talk about.
Okay, bro Sammy, we thank you, we thank you. There's a question for you. There's
Okay.
a question that, assuming the individual is experiencing the seizures, is there
Okay.
something that we can do in the house as a first aid management with the seizure? Thank you.
It is a very nice question. This is when normally we are faced with this situation, which is an emergency situation, and most of us don't have idea on how to help this person, and most especially the misconception surrounding the condition also prevent us from helping people when they are going through the attack, or when they are in the attack phase of the condition. So the first thing I want to talk about is, I want to clear the don'ts. The don'ts. In medical practice, it is always safe, if you don't know what to do, you don't do anything, than to even do something and complicate the condition. So the don'ts when one is having attack. The first thing is, in our locality, when one faints or when one falls down, when one is having a seizure attack, the first thing is, you see people pouring water on them. It is a no, no, no. Don't pour water on people who are suffering from seizure attack. That is one. Do not put anything in their mouth. That is when people will get their concussion trying to force it down the throat. No, or trying to put something in their mouth with the belief that they may bite their tongue. So when I put something in their mouth, they will not bite their tongue. No, all those things are misconception. We don't put anything in the mouth. At that stage, we maintain no pause. You don't also restrain the person. You hold the person firm so that the person don't fit. It is a don't. Don't do it. Allow the person to fit. Okay, so now let's look at, what then can I do? The first thing you have to do is, some people, when they're about to have the attack, they can see it, they can have a warning sign and inform you. If the client is able to inform you, or the person suffering from this attack is able to inform you, help the person to lie down at a safe place. But if the person is not able to inform you that I'm about to have an attack, what you do is, when the person falls, you protect the head. If you have anything soft, you put it under the head, so that the person, during the fit, during the jerky movement, the person don't cause more injury to the head. Okay, so you can protect the head of the person. Maybe if you have a pillow or even a cloth, you can fold it and put it under the head. Or even if it is your slippers, which is soft, you can put it under the around the occipital area, or wherever the person has fallen in. The second thing is, you losing tight clothing around the person, losing tight clothing, because the person will be unconscious. and there could be choking. So if the person is wearing belts, necklace, and those stuffs, you loosen it so that there will be free movement. There can be flow of blood to all parts of the body. If the person is wearing watch, you take it off so that it will not bring, it will not tighten the person. That's the second thing. Then, if it is possible for you to move the person, you move the person. But if not possible, if there is anything in the immediate environment where the person has fallen that could cause harm to the client, you take that thing off so that the client don't go and hit his or her head on those things, or the leg. That is what normally cause the fracture, the burns, and the wounds we have been seeing with people battling with epilepsy. So these are the basic things. And you don't wake the person up. Don't wake the person up. When the person falls into the coma, allow the person to sleep and wake up voluntarily on his own. Do not wake the person up if the person falls into the coma stage. And when the person awakes immediately, don't give the person anything to eat. You have to wait for a while for the person to regain full consciousness. Otherwise, just after the fits, normally the people become disorientated, they become confused and don't know what has happened, because whatever they have gone through, they themselves, they are not aware. Because I said at the initial stage that they lose consciousness. So you have to sit the person down and make sure that the person has gained full consciousness before you can even allow the person to engage in any other activity or even feeding. So that is what we can do at home. Then, yes, of course, if the person is on medication after the attack, you can assist the person to take his or her medication if it is due, or to send the person to the hospital after the attack. As I said, do not put anything in the mouth. Don't pour water on the person. Don't push anything in the mouth. Don't restrain the person from fitting. Just protect the person from anything around that could cause injury to the person. So that is what we can do at home when one
Thank
is.
you, thank you, thank you, thank you, Brother Sammy. Thank you for your time, your energy, your everything in helping Richmo Media viewers and listeners in this afternoon health discussion. Beloved, Brother Sammy has done his best. It's for us viewers, listeners to also put whatever he has told us into practice. So as we are bringing the lesson to a close, Brother Sammy, please, what is your take-home message for our viewers and listeners? Thank you.
So, thank you for your question. Too. What I want our listeners and our viewers to take home this afternoon is epilepsy or seizure disorder is a brain dysfunctioning. That means there's a problem with either part or the entire part of the brain or parts of the brain. It is a neurological disorder. It is not a communicable disease. You don't get it by helping the person suffering from the seizure. It is not a demonic disease. As I said, the chemicals in the brain send signals, and when the signals are oversent, that is when we have the seizures. Epilepsy is treatable. Epilepsy can be managed. Don't send the people to prayer camps and go and dump them there. The prognosis is better when the first attack you report to any nearby health facility and it is diagnosed and the treatment begins. The prognosis is better. As I said, about 70% will recover from the seizure when it is treated. So it is not a demonic attack, and we shouldn't stigmatize people who are suffering from epilepsy. Stigmatizing them worsens their condition. It doesn't help them to recover. So let us help a brother, a friend, a neighbor who is battling with epilepsy. And one day we can all live in a nation, a world free from epileptic attack.
Thank
Thank you.
you, thank you, thank you. God bless you, Brother Same. To our
God bless you
viewers
too.
and our listeners, God bless you all for your time. Note that epilepsy is treatable. Early detection will bring a good outcome. But when you
Yes.
delay in detecting and delayed in early intervention, that will lead to a worsened state. And by God's grace, we have known some simple strategies that we can also use to manage people also in our area we find ourselves. So may the good Lord be with us all. May He bless us all. May He continue to be with us. So, Brother Sami, we thank you, and we are hoping that today will not be the last time of our discussion, and we will find another time and come to your
All right.
doorsteps as well. So, epilepsy is a mental or a brain related problem. God be with us all, and may He strengthen us all as we put whatever we are discussing into practice. So, same time next week, RICHMO Media Health Issues. Thank you.
All our